Hi, I'm Dr. Kelly Miller. Today I want to talk to you about cholesterol, triglycerides, heart attacks, and strokes. You know, there are probably few other topics where there's so much misinformation that's been perpetuated upon doctors and the public than the significance of and the treatment of elevated cholesterol levels. You know, when I was first started my practice in 1980, and normal cholesterol was considered 280. In 1986, the value was lowered to 240. Then later it was again lowered to 200. Now there's a push by some to lower the level to 185. The general perception among most doctors and the public is that cholesterol is bad. Cholesterol is responsible for heart attacks and strokes. The perception is if you have a cholesterol level over 200, that you're at a higher risk for heart attack or stroke. If you are below 200, you're at a lower risk for heart attack or stroke. Unfortunately, it's just not that simple. Approximately 50% of the people who have heart attacks or strokes have what would be considered normal cholesterol levels. Accordingly, the Framingham study, the largest ongoing study of cholesterol, triglyceride levels, and the incidence of heart attacks and strokes over 20 plus years, over 20 plus thousand patients. The conclusions are there is only a slight risk or predictability in having heart attacks or strokes occur if your HT levels are below 50 and your triglyceride levels are over 150. These are the only statistical predictable factors that have been identified through this study. Despite tens of millions of people being placed on statin drugs, there has been no significant change in the epidemiology of heart attack and stroke in this country. The best study I've ever seen on the reduction in risk for heart attack and stroke in any cholesterol medication is approximately 1%. In other words, only 1 of 100 people in the study had only 1 in 100 had a reduced risk after being on the medication for over 3 years. In reality, there are 7 different subtypes of LDL cholesterol and 5 subtypes of HDL cholesterol. That means there are 12 types of cholesterol, not 2. One of these subtypes is called lipoprotein A, discovered in 1966. By the mid-90s, Nobel Prize winner Linus Pauling had made a determination that having high levels of lipoprotein A increased your risk factors tenfold of having a heart attack and stroke, and more importantly, identified specific nutritional deficiencies that enhance the occurrence of lipoprotein A and subsequent heart attacks and strokes. He developed a product called Cellular Essentials that contain vitamin C in water and oil-soluble forms, as well as specific amino acids and B vitamins that significantly reduce this risk factor. During this time, homocysteine was also linked to causing inflammation and damage in the vascular walls. Homocysteine is a byproduct of animal protein digestion when inadequate B vitamins are present. We now know that cholesterol medications or statin drugs inhibit a substance called BK4, which is inflammatory in nature. In other words, cholesterol medication's beneficial effect is probably due to its anti-inflammatory effect on the blood vessels versus the actual reduction of total cholesterol. Unfortunately, the inhibition of BK4 causes inhibition to our immune response. In other words, it causes immunosuppression. Furthermore, we now know that the increased likelihood of getting a heart attack and stroke is related to the size of the particles that carry the cholesterol, as in the case of lipoprotein A, which is a very, very small particle. Some of these particles are cellular in size, but most are much larger. A person is at increased risk if they have too many of these small type particles of the LDL types of cholesterol, one of which is lipoprotein A. This information can be obtained in what's called a VAP blood test. 99% of my patients have never had a VAP test. Also, we now know from gene testing who has increased risk for gene expression for heart attacks, heart disease, strokes, and other diseases. More importantly, we now know that what foods to eat or avoid to inhibit these gene expressions. Well, one might ask, why is this information important to me? Why do I need to know this? I'll just take the medication and therefore reduce my risk. Well, unfortunately, people die of heart attacks and strokes every day that are taking these statin drugs. And the following are a few side effects of these statin-type drugs: Parkinson's disease, Alzheimer's, congestive heart failure, myopathy, which means muscle destruction, neuropathy, nerve destruction, Lou Gehrig's disease, or ALS, loss of cognitive function, including temporary amnesia, depression, and impotence. The loss of cognitive function is widespread in many reports. It causes what I laughingly refer to as CRS syndrome to my patients. Can't remember shit syndrome. They all get a laugh out of that because it's so true. There's an inherent danger, in taking statin drugs and driving cholesterol rates too low. Increased morbidity rates have been demonstrated in patients with cholesterol levels below 145. Statin drugs cause B6, B12, and coenzyme Q10 deficiencies. These B vitamin deficiencies cause increased homocysteine production, increased inflammation from the blood vessels. B vitamins are necessary in every metabolic process in our bodies. Coenzyme Q10 is a vital, necessary nutrient for our brain, nervous system, and heart function. In Europe, a person cannot receive a statin drug without the accompanying coenzyme Q10 with it because of the potential for damage to the nervous system and the heart associated with this statin-induced Q10 deficiency. Cholesterol is manufactured by our glial cells in our brains and by our spinal cords. The myelin sheath surrounding our spinal cord and peripheral nerves are made up of a cholesterol-like material. All hormones produced in our body come from cholesterol. Cholesterol is converted into pregnenolone, which is known as the mother of all hormones. Pregnenolone is then converted into other hormones, such as testosterone, estrogen, progesterone. The real key to reducing risk for heart attacks and stroke is related to reducing inflammation within the blood vessels and addressing any potential blood clotting factor problems. Approximately 1 in 4 of the population have potential blood clotting issues. Again, prevention and treatment would be dependent upon identifying high-risk factors via VAP testing, too many small particles, and then gene testing for optimal food intake. This will give information as to what type of food and proportion of fat, protein, carbohydrates, and what kind of exercise, aerobic or anaerobic, is optimal for each gene pattern. Appropriate diet and exercise and supplementation therefore reduces negative gene expression. We now know that B vitamins reduce homocysteine production, which causes inflammation. We also know that fish oil reduces inflammation in blood vessels. We know that magnesium L-arginine reduces inflammation and plaquing in the blood vessels. Niacin decreases LDL and increases HDL and decreases triglycerides. We know that red rice yeast is nature's own statin and can be used to reduce cholesterol and triglyceride levels, always coupled with coenzyme Q10. We know that soluble fibers in a diet decrease LDL, increase your HDL, and markedly reduce your triglycerides. Besides reducing cardiovascular risk, increasing soluble fibers in our diet decreases risk of most gastrointestinal problems, including colon cancer. There are a number of things we can do with appropriate whole food diet changes and supplementations to markedly reduce our risk for cardiovascular events.